Okay, so I'm Karen. I came in to have 3 implants, one on the right and 2 next to each other on the left. I wasn't nervous at all. It had never crossed my mind to have sedation. Just hadn't crossed my mind. But one friend who'd had a similar treatment, she said, you must have sedation. It makes it so easy. And another friend didn't have sedation and she really regretted it. So I thought, I'll go for it. But I really wasn't nervous at all. The actual sedation was amazing. I have had a lot of anaesthetics. I've had quite a few operations. This was the quickest sedation I'd ever had in my life. It was literally, I think, Jeff was talking to me, the dentist was talking to me, and the next thing I woke up. It was so easy, so simple. In fact, I did say to the dentist the next time I saw him, it was the best sedation or anaesthetic I'd ever had in my life.
That's really kind, thank you. We all had an assessment procedure where the positives and the negatives, if you like, are all discussed, and we try and decide the kindest way forward for the patient. And if the patient isn't dentally anxious, then there's still a surgical element. So again, we weigh up the whole procedure and work out what the kindest way of treating the patient is going to be. And as Karen mentioned just now, what might be quite a lengthy procedure in terms of time, the patient can appear as if it's over in the blink of an eye, really. And taking that patient forward, it then alleviates any reasonable possibility of dental anxiety going forward, because the one thing we don't want to create is an anxious patient from a non-anxious patient. That's a real miss. So again, going back to what was talked about earlier on, we create a complete picture of the procedure and a complete picture as close as we can of what the patient's requirements are and what would be in the patient's best interest going forward. And if we feel it's sedation, then we will discuss it, ultimately the patient's decision whether they want to go ahead with that or not. And if they don't want to go ahead with it for whatever reason, that's absolutely fine. But it can certainly help us to provide what we feel is the best appropriate treatment.
Well, let's put it this way. If Jeff needed somebody to practice on, I'd be quite happy to come in once a week and have sedation. I really would.